Hello and welcome to my educational video series. I'm Dr. Hadi. I'm a gynecologist specializing in fertility investigations and treatments. And today I want to talk about Sono histogram, SIS, ultrasound with dye. They call it different names out there. So what is this? In short, this is an ultrasound that is usually done on two different occasions. The first one is a regular pelvic ultrasound, if there is ever a regular thing about that, where the first session you come, you have an abdominal ultrasound and an internal ultrasound, and this checks the shape of the uterus from the outside, the size of the uterus, the shape of the ovaries, the size of the ovaries, and this is where maybe we can tell you if you have ovarian cysts, PCO, we'll talk about PCO later, or you have fibroids, or if you have other things. And then typically this is one day. The second day is when the period has finished. You should not be on your period, and you should not be close to ovulation or after ovulation. We want to make sure that if a baby is trying to sit inside the uterus, that we don't disturb that. So the second part is something like a pap test and an ultrasound done at the same time. So the pap test, I mean, we use this speculum to be able to see the cervix. And then we use very small catheters, very small plastic tubes that go through the cervix. We inject a little bit of fluid so that we distend the cavity of the uterus to be able to check that the cavity is normal from the inside. There is no polyp, there is no small fibroid or other things. And then we typically inject a special type of dye or foam or something like that to check that the tubes are open and make sure that the journey of the sperm going through the cervix, through the uterus, through the tubes can reach the ovaries. Is this needed? Yeah, I want to say yes, essential, yes. Can we skip it? Maybe, but then your fertility investigations are not complete, because if there is something maybe like a polyp or a blockage in the tube, we miss that and we don't know, and maybe we're wasting time or effort or emotions in trying to get pregnant where there is a problem that would prevent that. Is it painful? I hear this often, I hear this a lot. I hear people reading horror stories on the internet and reviews about how painful it is. I cannot say that it's not painful. I cannot say that some people sometimes feel pain, but we do this a lot. We do this every day. We do this many times every day. And my observation, I didn't have it done myself, but I've seen a lot of them done. In most cases, when we finish, people say, oh, this is not what I thought. I thought it would be more painful than that. Typically, if you feel anything, you feel something like a cramp, like a period cramp, nothing really severe, nothing really out of the ordinary. Again, some people are more sensitive than others. Now, is there a special preparation for that? We will review that if you come, or most clinics will review that when you go to them. They will tell you how to prepare. They will tell you what to expect after the procedure. We might leak a little bit of water, a little bit of spots of blood for a couple of days. Typically, you're then booked to follow up with your physician to review the results and talk about next steps and talk about questions related to other steps of your treatment. There will be more videos about PCO. I want to talk about that. Come back and review our other videos, and hopefully this helps you through your sometimes difficult, sometimes long, hopefully good outcome journey at the end. Thank you for listening. Thank you for watching. I'm Dr. Hadi. See you soon.